Hey everybody, this is Kathy Randall from Synapse Care Solutions, and I just had this idea this morning that came from one of my friends who has a sister who is a NICU nurse, and she said she's not coming to the one conference because the one conference is only for units that do cooling, that the one conference is only for hospitals that have aEEG machines, and that the one conference is only for neuro NICUs. So when we first created the Neuro NICU idea, or the conference, the one conference, we did say it's a Neuro NICU training. But I think that over the years, what most of us have really realized is that every NICU is a Neuro NICU. And so some of my programs, one of them is called Every NICU is a Neuro NICU, really shares how every single day what we do matters. Every single day what we do is impacting a baby's brain. And so the one conference is really about you, that one person who can make a difference in one baby's life, in one family's life, in one moment with one care practice that you choose to do. And so the one conference is about caring for the baby's brain, but every baby has a brain. So we want everyone to come, whoever cares for a NICU or for a NICU baby. Doesn't matter where you practice. So some of the topics that we're going to go over this year, we have actually 2 lectures, one on cooling, just kind of an update on what it is and how we're doing, and one on aEEG. So if you don't use those things, then you can stay on a break longer, or you can come and maybe you'll decide you need to be doing these things in your unit. But there are actually 12 other lectures that don't have anything to do with cooling. They don't have anything to do with aEEG, and so they apply to everyday practice. So we're going to focus a lot on just ourselves as practitioners and just how do we find hope in the NICU, how do we care for ourselves, provide self-care so that we can do our job better. But we're also going to talk about neonatal pain. We're going to talk about neonatal sleep. We're going to talk about how do you implement new projects in your NICU. We're going to talk about just the basics. We're going to do a great review on neonatal exam and neonatal brain injury. We're going to just do an in-depth look at those and look at some cases and some outcomes of those patients. We're going to look at doing NICU care outside of the US, going on missions. What could be your role in that? We're going to talk around CP. We're going to do a review of CP, the dreaded diagnosis of CP. So we're going to take a deep dive into that. Joan Smith from St. Louis University, she's going to talk about her SENSE program. That's that sensory program where you give certain therapies at different gestational ages. That applies to all of us because our babies are developing their sensory system right there in the NICU. We're going to talk about long-term outcomes, how minor morbidities are not that minor, and how we can work on that. Chris Carlson from the Stable program, she's going to talk about hypoglycemia and what are the brain injuries that happen from that. That applies to big babies, small babies, community hospitals, teaching hospitals. We have hypoglycemia babies every day in every nursery, in every delivery room, right, in a day, in every labor and delivery unit. They encounter a hypoglycemic kid. What is the outcome of that? So I just wanted to encourage you to rethink your NICU practice, and to really realize that every NICU provides a developmental care program, whether you have a program or not. Babies' brains and their families are developing every single day. And that is really what the one conference is about. The one conference is, what are those little tiny things we do and we can do, or that we could do better, that make a difference for a baby and their brain and their long-term outcomes. So every NICU is a Neuro NICU, which means that every one of you can and should be coming to the one conference. So I just wanted to clear that up, make sure that you're aware of that, and just encourage you to check it out. Go to synapsecare.com. Take advantage of some of our free programs. We have aEEG free programs. Every NICU is a Neuro NICU. We did Developmental Care Book Club this last year. So many free resources. And of course, the one conference is coming up in February. So depending on when you watch this video, it's coming up February 3rd to 5th. but we would love to see you there. So if you have any questions, message me here. Happy to answer them, but really want to see you at the One Conference. So anyways, have a great weekend, and hopefully we'll see you at the One Conference.